okay, of the ulna. Those are the three motions of the ulna that technically medial glide doesn't, like if it was a multiple choice question on an exam, it would be lateral glide and posterior glide. That would be the answer. But clinically, I'm telling you medial glide is sometimes the problem. So clinically, those three would be what you assess. And then you also have to assess the radius on the humerus, which we're gonna do next. And then depending on which one of those were tight, okay, and remember, all of them can be tight. Because if you're in a cast for 8 weeks and you come out of a cast, they're probably all gonna be tight. Or if he fell yesterday on his arm and he's swollen, it's gonna be none of those potentially because he's got a lot of swelling. So you might just do some, and your end feels for extension are gonna be boggy and squishy, okay? And he's gonna have notable swelling, and so you're not doing grade 4s for that, okay? So just because someone has limitations in motion, you have to identify what's causing the limitation. If it's a joint capsule, we're doing joint mobility, our end feels are capsular and tight, we're doing grade 4s. If I'm doing the joint mobility and I feel squishy end feels, I'm doing a lot of 50% exercise for blood flow to push the inflammation out, okay? If I have extension and it's a hard end feel, hard muscle guarded end feel, and it's this, I'm gonna be doing a lot of soft tissue with some max isometrics and then maybe some oscillations and then 50% either elbow flexion or if it's biceps supination as well, because biceps are primary supinator and brachialis and biceps both do elbow flexion. So I'll be trying to vascularize the biceps specifically, okay? So to take a step back, we're doing these assessments to see what the problem is, and we're gonna treat what our impairments are based on what we find. If you do your joint mobility and everything feels great and they're still limited with extension, you have to go back to just a passive range of motion, like what's limiting it. And that's why we do joint mobility after passive range of motion, because when I do passive range of motion, I should have an idea. If I get a firm capsular end feel, I should suspect a capsular tightness when I do the joint mobility. If I get a boggy end feel, which is squishy, that's swelling. If I get a hard guarded end feel with pain in the front, that's muscle guarding, okay? And we have paired treatments for all those things. And that's really what average PTs miss. If range of motion's lost, they're just stretching or just mobilizing. Oh, I went to this course this weekend. I learned lateral glide at the humeral ulnar joint. Oh, my elbow extension patients are gonna be cured. If they don't have lateral elbow tightness, you're just wasting your time. So that's why we learn all the different tests for it. Okay, cool. So there is something called a varus and valgus special test, as you guys know. So the difference between glides and the varus and valgus is, and we're gonna show these in the afternoon, but just because it came up now, when I'm doing a valgus test, okay, imagine this is the humerus and this is the ulna, okay? So flexion extension, yes? Okay, the glides are like this. They're just on the ulna, I'm blocking the humerus, I'm doing parallel to the joint. For a valgus or varus test, I have to be with one hand on both the humerus and ulna, and when I push, I get that bending, and that's what stretches that ligament on that side. Or I push from both the humerus and ulna, and I get that bending, which stretches that other side of the joint ligament. Okay, so that's the difference. Little nuance, but totally changes the technique. One is a joint glide, one is a ligament stretch. Great. Okay. And those can get tight too, especially on the radial side. Because you have this valgus angle, you have this carrying angle, you never stretch the medial side of the joint. But the lateral side of the joint, because of chronic tendonitis here, you can get scar tissue in that joint capsule and it can be tight. So you can actually use the varus test as a treatment, as a stretch. And I want to say it again, just for everybody, you never do this one, okay? Because that's usually loose. This will be your one of your treatments for chronic lateral elbow pain due to chronic tendonitis, because you get a lot of scar tissue there and it gets tight. And so you can use it. It's actually one of the manipulations. You guys have probably heard of a lateral elbow manipulation. That's why you do it. And that's just the varus test is just the non-thrust way to do it. And then there's a thrust way to do it. Okay, cool. Next one up, now we did all